I'm going to demonstrate positioning for flexion extension of the cervical spine. Now, I am going to demonstrate the position on myself, but before you do this at clinical, make sure you know the protocol for your department. Oftentimes, they may have you do a neutral projection first and then have that cleared by the radiologist. Or you may have to make sure that the patient has had prior x-rays of the cervical spine and there are no fractures or degenerative disease, because you don't want to do this projection and cause harm on the patient. So make sure you know the protocol for your department before you do this at clinical. Basically, you are going to use a 60 to 72 SID for this projection. 72 is recommended because you can see all the way to C7 on most patients. We're going to use a collimation of 10 by 12. And you can do this as a right or left lateral. I'm going to do the right lateral so you can see the position of the patient. Again, you would do this as the patient can do. You don't want to force the patient to do more than they can. And this is a test of function. So if the patient is unable to flex or extend their neck, then that's the reason why we're doing this position. And that's why we ask the patient to do the best that they can. Okay, so I am going to position the patient with their right or left shoulder against the IR. And I want to center the mid-coronal plane to the mid-coronal plane of the buccal, mid-coronal plane of the head and neck. And then I would ask the patient to just simply put their chin as close as they can to their chest, and I would have them hold their breath. Once that exposure has been taken, I will keep the patient in the same position and make sure the patient is stable on their feet. So what I have is a patient standing with their feet apart a little bit so that they're not swaying, because you don't want that. You want the patient to be comfortable when they're doing this. The next position would be the one of extension. And then in this case, I'm going to ask the patient to tilt their head back as far as they can, lift their chin up and look up. I would ask the patient to suspend their breathing, and then I will take the exposure. So those are the two positions for flexion and extension. Your central ray is centering at the level of C4, and at the mid-coronal plane of the neck and head, you have a 12 by 10 collimated field, and you're doing this on suspend respiration. Again, just ask the patient to either bring their chin down or up. In my case, I've had these done because I have degenerative disease at the level C6, 7, and so the bodies of my spine are slipping forward a little bit. So it's important to make sure you don't force the patient to do any more than they can do. That's it for flexion extension of the C-spine.